quality of the critical thinker. So go back to your slides, find the critical thinking, what is the critical thinking, what is the quality of the critical thinker, and just study those. That's your answer. Come on guys, see 5 more minutes, make a difference. So you're gonna share it anyway. And
were you starting already the review?
no, I'm gonna start it now.
Oh, I thought you
I
were
haven't
starting.
started. So you share it with me. I put it in the notification for a student, you know, or I share it as a mass email for everybody.
Okay.
Some of them people they're not there. So, okay, guys, I'm gonna start it. Make sure you know who discovered the X-ray. Who discovered the X-ray? Röntgen, you know. So I hope you know that. Don't come back in the fall as an X-ray student and you don't know who discovered the X-ray. So I don't know how to put. So remember the phases in learning sequences. You know how to learn. You know the learning sequences phases like observation, assistant, performance. So remember who is the radiologist, who is the technologist, the difference between these, you know. Radiologist, who's the radiologist?
The doctor.
Is a doctor. So remember that there are differences. So sometimes I put radiology, radiologist, radiographer. So make sure you know those. You know. So what is the accreditation? What is the licensor? What is the registration? Registration, accreditation, licensor. What are the differences? So when you finish your program, you're gonna get your license. So who's gonna give you the license? Which society? ARRT, no? So study those. Let's say, who's gonna give the college the accreditation, you know? Which entity, which organization, you know, those things. She's gonna put it in, I'm gonna put it she's gonna type it and I'm gonna send you as a mass email if you miss something, because I don't wanna make them wait anymore. Sorry about that. Okay, so again, the difference between radiology, radiologist, radiographer. So when we graduated, what they call it, registered technologist / radiographer. No, registered technologist / radiographer. That's what they call us. So know the difference between those. Okay. A step in the problem solving. Identifying the problem, developing an alternative solution. They are problem solving steps, no? Just go back to your PowerPoint, find the steps in the problem solving process and just read them. So sometimes I ask you what is not in this category, so you know they are the steps that you have to know, and then something is weird in that steps, so you said, oh, this is not part of the problem solving process, okay? So again, knows about cosmic, gamma, X-ray. You said, remember that? Cosmic ray, gamma, X-ray was part of your homework, and infrared. So remember about the modalities, like we have sonography, radiation therapy. So radiation therapy is what? Is for the treatment of the disease, no?
Yeah.
So remember that radiation therapy is for the treatment of the disease. So ultrasound's modality involve radiation or not? No, so make sure you know those. Which modalities involve radiation, which modality doesn't involve radiation. So the more you your education, let's say you are into the program, the more you excel and more go forward, your education goes toward the clinical sides or just didactical? Which one is
Clinic.
clinic? No? You go more to clinic and didactical gets less and less and more clinic. Okay, no? Yes? Study that. Okay, this one again. The date of the discovery of the X-ray, 1895, yes. So again, who certify us to become radiologists, technologists? Which organization? ARRT, remember that. And what ARRT stands for?
American
Registry of Radiology Technologies. Okay, quality of the critical thinker again, open-minded, rational, inclusive. I'm gonna send you an email, it's the people that missed the review, some of them. So have a seat, so. So what is bone densitometry? What is the bone densitometry? We use it for what? What kind of modality is that? To diagnose
to
what?
diagnose bone disease.
Osteoporosis. Yes. So bone densitometry, diagnosis for the osteoporosis. You know. So what do we need to create an X-ray? How X-ray created?
Vacuum.
In a vacuum, yeah. Study that. What do we need? High voltage electron, source of electron, target to stop the acceleration. We need all of those. You know, so sometimes I ask, they are all of the following, they are related except, so you know what do you need for X-ray. So something is fishy, it's not there, okay? So how about the remnant radiation? Remnant radiation, what was the remnant radiation?
The radiation after it leaves.
Exit the patient, yeah, the radiation exit the patient and hit the image receptor. That's the remnant radiation, isn't it? So study those. Primary, what is primary? What is remnant? What is a scatter? Study those. So if I ask you something, or if you said, oh, I know that. So most of the X-ray energy turn into what? Heat. Yeah, it's getting hot most of it. 1%, just less than 1% turn into the X-ray. I'm gonna send a mass. Somebody's gonna send me the review, and I'm gonna send a mass email about her review. But you can continue because I started a little bit early. I'm sorry. Where was I? Okay, so that was that. Okay, so we have this. We have this. Okay, what is fluoroscopy, guys? What is fluoroscopy?
Not in lab X-ray.
Say it again.
Lab X-ray.
Live X-ray, yeah. X-ray movie. So guys, again, bring your calculator. I sent you an email. You have to just calculate mass. How we calculate mass? MA times the time that we spend for the X-ray. So it's going to be MAS. Okay. Okay. So if you want to find the density, I give you, let's say, MA times S, MA times S, time, you know, and whichever is more MAS, is more density, okay? Just remember that. You know that because before I tested you. You times, and I give you like a 4 off. Where is my tape? Where is my? Okay, I'm losing things, I'm losing my mind. Okay, easy. So let's say I do this 200 MA times 0.2, 300 MA, oh my God, it's times, you don't even see it, I know, I'm sorry. So times 0.3 and 100 MA times 0.1. So I ask you which one has more density. So you time it, and whatever is more MAS, like if you time it, whatever has more MAS, that's more density, okay? Just you have it in your test, you have it in your homework, so it's nothing that as I said it to you before. Oh, where I am, okay. Again, what control the radiography density? I just talked about it. Milliamperage second, MAS. Say it again.
The brightness, the
No,
contrast.
density, black and white.
The black and white
So
contrast.
what control, when it's darker or
One
when
is-
it's lighter, so what control it?
EMS.
Yes, MAS,
Can
okay?
you say what
Milliampere,
controls?
yes. What control radiographic density mostly? So milliampere per second, no? MAS. So again, you have to find MAS, MA times whatever time I give it to you, just time it, and you're gonna find the MAS answer, okay? I gave you 300 MA, 0.03 time, so I ask you what is the MAS, so you just time it and find the answer. Am I good? Do you get it? That's it. Nothing, and so bring your note, you can bring your inverse square law, you can bring it. I'm gonna ask like a 2 question about inverse square law, so bring your note, bring your formula, and you can do it, okay? That's the last time you can bring your formula, because during the program there is no formula, you have to remember. So, I just wanna give you some repetition, and you're gonna learn more. So what is attenuation? What happened? An X-ray passed through the body, it attenuated, it loses its energy, no? Yes? Don't talk to me. Okay. What is collimator? Collimation? You change the size and shape of the collimation, you know the collimation. You know what is collimation? No? Yes? So I put my hands here for the X-ray. So there is I don't want the X-ray go all around that big. I just want collimated to the size and shape of the X-ray. So I control the X-ray beam, okay? That's they call it collimation, okay? Question, concern? I'm gonna send you an email, send the people they listed an email about the whole review, okay? So what is RAD means? Radiation absorbed dose, no? Again, inverse square law. You can bring your formula for inverse square law. Remember cardinal principle radiation protection rules? Time, shield, distance, no?
Can you repeat that
Time.
one more time?
Cardinal principle of radiation protection. Time, shield, distance. So remember the relationship between KBP and scatter radiation. KBP increase, KBP is the energy, remember that? When the energy is increased, what happens to the scatter? Increases. Yeah, makes sense. So how about the contrast? KBP increase, what happened to the black and white of the contrast? Decreases. So remember that. grid? What is grid for? Improve contrast, decrease the scatter.
To reduce the scatter.
Very good, and improve the contrast. So remember that what unit measure the biologic effect on different type of radiation? What unit? Okay. What unit measure the biologic effect of different types of radiation? REM, REM, Sabre, radiation equivalent length. Remember that. Go over that measurement and radiation, units and study those. RAD, RAM. I just give you the question. Just guys go and read it. Maybe I can change the question a little bit here and there. What is RAM, and just remember it. So again, how X-ray is produced, remember that? I want you to know about the X-ray, how X-ray produces. So what is photoelectric interaction? I just try to not give you the whole answer. It's so difficult. So it's gonna be the greatest hazard to patient, no? Photoelectric interaction. Remember this, it's just connected to each other. So, what is RAD? RAD, radiation absorbed dose.
Is it dose or density?
Dose is a unit. Amount of energy that we absorb or any medium absorb, they are measured by RAD. Again, how many Sabre is the Sabre is equivalent to how many RAM? So let's say 3 Sabre is equivalent to how many RAM? 3 times what? 100? It's going to be 300. So remember those. Just the things that I highlighted red about the measurement, just study those. I just give you the question. Just go back there and study. I might do it the other way. Just I want to give you that, some thinking that the connection between RAD and Sabre and RAM, know those. Not too much, just the things that I highlighted and just give it to you. I don't want you to overstudy. ALARA, what ALARA stands for? To keep radiation as low as reasonably achievable. Not possible, achievable. ALARA. Keep radiation exposure as low as reasonably achievable. Maybe. Okay, so let's see. Okay, so okay, so remember that greatest damage to tissue is how can I change this? The tissue that has rapidly dividing cell. Is that tissue that is get more damage from radiation or less damage? More damage, no? So like a embryo, yes, their cells, they are rapidly dividing. So remember that when you radiate a pregnant woman, the first trimester is affected affect more the embryo because the cells, they are rapidly dividing, okay? So remember the early symptoms of acute radiation. Early symptoms of acute radiation syndromes. What is the early symptom? I'm nauseous. I'm vomiting. Very good.
Is it,
That's it. That's all you have to know. Don't ask more than that. Because the student get confused. Just nausea and vomiting. Go read it again, but just the earliest symptoms is that, okay? There are other symptoms comes with it. So the apron that we use for protection, what material that apron has? Yes, you know something. Thank God. Okay, guys, study the law of Borgoni and Tribendum. I want you to study that. I can't go any further. I can give you the answer. So which ionizing radiation is more powerful to human body? Direct one or indirect one? So again, study the acute radiation syndromes. Study the prenormal period, latent period, manifest stage. You know, just study that acute radiation syndrome. So occupational workers gets which scatter more? Compton's? No? Occupational work get Compton scatter, no? She's gonna send an email to you for the whole review. So it was your test question. The tabletop material, we have high attenuation or low attenuation. Remember that. Tabletop material have low X-ray attenuation or high X-ray attenuation. I don't give you the answer. So remember all those. What is exposure in air means? Röntgen? No? Yes? What is cultural diversity? Cultural diversity? So remember that method of the transmission of the disease, like a direct, indirect. So let's say I kiss you and I'm sick. What kind of method is that? Direct? Just kiss you. Highest level of Maslow hierarchy. What is that? Highest one? Self-actualization. Yeah. So study the Maslow hierarchy. I want you to study the first level and last level, and somehow between. I can start to get mean, so ask me between. No, I won't. So so remember, guys, how we can get the blood pressure. How we can take the blood pressure? What kind of instrument do we need?
Seismograph?
Just keep it for yourself. Just go study it. I know you know that. And what is the subjective patient data? What is the objective patient data?
I feel.
Yeah, just remember, just study those. So I might ask a question. All of these, they are subjective. Expect all of these, they are objective, not included. You know, just know what are objective and subjective. Don't memorize it. Make sense out of it. It doesn't need to be memorized. Blood pressure. what is the first stage of acceptance of dying for a terminally ill patient? Denial and anger, yeah, very good. So study this sacred 7 elements of patient clinical history. So how can, through which organization can we find the code of ethic? Code of ethic? ARRT. So if patient has just his or her blood sugar drop, hypoglycemia, what we gonna do? Give her glucose, sugar, orange juice, candy, okay?
Some
Hypoglycemia.
sweet, as they say,
Hypoglycemia.
like orange juice.
Yes, sure. Again, administrated contrast media, what happened, what kind of shock the patient might have? Anaphylactic shock. So I texted something bad about you to her. What kind of defamation called? Libel, yes. Study those defamation. Yes, libel. So, guys, if I wanted to, you wanted to do some X-ray on me, and I said no, patient has a right to do that. Say no, so you cannot force the patient to do any whatever you want to do. Even you cannot force the patient move from a wheelchair to the table. You cannot. If they say I don't want to move, patient doesn't want to move. You have to find to do some X-ray when patient is sitting. If it's not possible, you have to talk with your supervisor. You cannot force the patient. No, I want to do it upright the way I want it. It's easier for me. No, it's not easy. They don't want to do it. That's it. Period. So what is orthostatic hypotension? Just patient is laying down, get up, sudden drop of blood pressure.
What is
Orthostatic hypotension. Oh my God. Okay, when you wanna transfer patient, which side you should take care of? You know?
The strongest side.
Yeah, makes sense. So, if you give a drug parenterally, what is parenterally means? You
Injection.
Injection. So if I say something bad about her in the elevator, what they call it? Slander. Yeah. So patient came with the cervical collar, from an accident or something. He was walking, but he has his cervical collar. Can you remove it to do?
No.
So you have to, what you do? Wait, the doctor do the clearance, said you can remove. You cannot remove it if the patient even is walking, say, oh, I had an accident 2 weeks ago, but I have this. You don't touch it, you ask the doctor, what can I do? I want to do cervical spine x-ray, can I do it? And the doctor said, okay, you can, you will remove it. If he said no, you take that with the cervical arm. It is very important, guys. Where I am. Okay, okay. Again, I ask you that. Normal range of blood pressure, guys. 120 over 80, just, I might ask 120 diastolic over 80 systolic. I may change it, so remember what is systolic over diastolic. Remember that, because I'm gonna get me changed next week. Okay. Okay, so if you treat the patient to do your X-ray, say, okay, if you move, I don't know, punch you in the face, or I
That's a
don't.
battery.
So assault. Threat is an assault. Remember that. Okay, study what parenteral drug administration means. I want you to know that it's all injection. So if something is sublingual, it's not part of injection, isn't it? So write it down. That's your test question. Okay, so if you touch the patient without asking the permission, it's gonna be what?
Battery.
Battery. So remember that. I keep asking my student, even you are practicing in lab, ask permission. Even your classmate, I know, I understand, but I gonna touch your nipple. I'm going to touch, especially male to the female patient. It's a big deal, guys. And some females, they just gonna make a scene. I say, oh, he touched my belly very badly. Oh, yeah. And he didn't ask my permission, he just pressed my belly. It's a big deal, I'm telling you. Battery, remember that. So if you don't ask permission and just restrain patient with just tape and everything, what they call it? Forceps. So what are vital signs? Remember that. Pulse, temperature, blood pressure. So remember what are the vital signs?
Heart rate.
Respiration. Yeah, respiration. So signs. So remember signs and symptoms of moderate adverse reaction to the contrast media. It was part of your homework. Guys, remember that. Okay, how you read the blood pressure? Systolic over? So this is part of your homework. Most accurate to read the body temperature. Which way is rectal? Yeah. So you want to do the procedure to a patient. So consent, you give it before or you give it after the procedure?
Before.
Alright, so what else? So what is fidelity?
Loyal.
Fidelity.
Being
Loyal.
Just write it down and go find it. What is that? What is justice? Alright, so again, study fomite, vector, aerosol, touching, the form of transmission, direct or indirect form of transmission. Just remember which one is direct, which one. Okay, so what is sterilization? Is hand washing is part of the sterilization?
Yes.
No. Sterilization is a removal of all the pathogen, everything. When you wash your hand, everything is not removed. It's clean, but
Disinfection.
it's not, yeah, it's a part of disinfecting, but sterilization is a removal of everything. All kind of pathogen might be in the air, whatever. So what is vector? So let's say you're bitten by a mosquito. Is a vector? Yeah, it's a vector. So, and what is the Latin for let master answer?
Responding.
Respondent, yeah, respondent superior. What is veracity means? Veracity, be honest, yeah, be honest. Don't say that barium tastes like a vanilla. Yeah. What HIPAA stands for? HIPAA, HIPPA, Health Insurance Probability Accountability Act. What is that for, HIPAA? Patient record confidentiality. Remember that. This is very, very important. Guys, they're gonna ask you for all the time for HIPAA. All the hospital you go for training, there is a review about HIPAA. And so what is liturgy means? It's part of your homework. Liturgy. Deteriorated the head injury. What sublingual means? You put this drug under your tongue, no? Sublingual? Is hand washing is a method of sterilization? No. Don't put in me yes. I'm gonna very someone. What is nosocomial infection? You go healthy to the hospital and you get some sort of germ from the hospital, isn't it? Nosocomial infection. So what beneficence means? Action to benefit others. Beneficence. No? Study that. Oh. Okay. What is the, the drug brand's name? Remember those, the drug manufacturer, all the drug manufacturers, the drugs names. If I put by mistake, the doctor put scissors in the stomach, in the patient's abdomen and close the abdomen and you see the scissors in the x-ray, what that calls, the term in Latin.
The thing that speaks for itself.
I think it speaks for itself. But what is the Latin one?
Res.
Ipsa loquitur. So remember that.
How do you
The
spell it?
things speak for itself.
How do you spell it?
Okay. Res, R-E-S, I-P-S-A, loquitur. L-O, I believe, Q-U-I-T-U-R. Quitur. I'm not very good in Latin. What is that? L-O-Q, yeah. It's not considered, okay. So, you have, this is a sterile, I gotta put it there, but is it kind of little crack in it, a sterile box? So, I'm not sure if it's sterile or not. What are you gonna do? And report it. Because everything in your hospital has a number, every drugs, everything. You just cannot, the drug cannot be vanished. You have to report it that this is sterile package has a crack in it or expiration date or it's dead, something. The drugs number, everything. Routing number and report it, write it down and throw it out, okay? So as a technologist, what should we know if something happened, emergency happened? What should we know about our surrounding?
Look for nearby barriers.
Say the, yes, yeah, you have to know where is the crash card is, no? Yes?
Yes.
So you have to know all of this, okay? So you know where is the AED, where is the, what is the code? Code blue, the number of the physician. You have to know your surrounding. But there are three important things that you have to know. And the rest is just, guys, I gave you literally 99% of my test question. I might change it a little bit here and there. It's not going to be that straight, but when I said study this, please go to the PowerPoint and go back and study. Yes, sir. It's going to be almost 100, I'm not sure. Yes, 90 something. But just go back to PowerPoint and study it. Not just study that, study it the other way. What are not included? So they are included. So I might ask, what is not included in that? You know what I mean? All of these, they are okay, except what? So if you know the answer, you know all those steps, you know, oh, this looks fishy. I didn't study that. I don't even see what is that. You know what I mean? I make it easy. I don't make it confusing. But study it, please. That's it. And I'm gonna, Gabriel, please send an email. I'm gonna go over your question. I'm gonna fix it if it's not right according to the book.
But I don't think it was asked in this test.
No,
No.
it just I asked something about